Thank you so much for joining us today. We had an amazing response to this webinar. So much interest, and we're so glad that so many of you are making the time today to join. So being in Switzerland, I like punctuality, so let's get started. My name is Sean Fury, and I am the Secretariat Director of the Rural Water Supply Network, RWSN, hosted by SCAT Foundation. It gives me enormous pleasure to welcome you to this webinar that marks the launch of the updated World Health Organization guidelines for small drinking water supplies and sanitary inspection tools. For those that don't know RWSN, we've been a network that's been going since 1992, and we're the global network for rural water supply professionals worldwide. We've run hundreds of webinars since 2012, but this one has just blown us away. Our previous record attendance was near 500 in June 2020 at the height of the COVID lockdowns. But we're looking to break that record today with over 2,000 people who've registered. You can download the presentation slide decks, which have been translated into various languages. So if you want to download them and follow along in your own language, you can do that. Links will be provided in the chat box. The links to the guidelines documents will also be posted in the chat and in the description on YouTube. So with that, I would just like to welcome you again on behalf of the Rural Water Supply Network, RWSN. If you aren't a member already, you can join us as an individual or as organization so that we're part of many other great knowledge exchange and learning activities that we run. A huge thank you to the team at WHO. It's been such a great partnership, and I will now hand the baton to Oliver Schmoll, Water and Climate Program Manager at WHO Europe, who will be your guide for the rest of today's journey. Thank you.
Thank you so much, Sean, for the introduction. Good morning, good day, good afternoon, good evening, dear colleagues. My name is Oliver Schmoll, and I'm working for the WHO Regional Office for Europe, and I'm quite excited that have been asked to chair today's launch session of the new guidelines for small water supplies of WHO. I would like to echo the thanks of Jean and play back the thanks and thanking the Rural Water Supply Network Secretariat and Jean and his wonderful team for hosting this session today. This is really fantastic. Today we speak about small water supplies, and small water supplies are important in terms of serving very many parts, many people who live in rural areas. And this is true for all global regions, wherever we live. And ensuring the safety of these water supplies, these small water supplies, is essential in promoting health and protecting health of rural communities. However, on the other hand, we are all aware that there are several challenges related to ensuring safe water in small systems. And this is why they require explicit consideration, both in policies and regulations, but also in day-to-day management and in surveillance, and last not least, also in the financing. And this is why these guidelines that are being launched today are so important for WHO. They are really meant to support professionals in policy and in practice, to support them in making small systems safe and sustainable. And you may find it interesting to know that guidelines on rural water supply and small systems have been prioritized by WHO not long since WHO's inception. And the first ever small systems guidelines were introduced already back in the 1950s. And actually, I went to my shelf and indeed found the copy of the first edition of these guidelines from 1959, Water Supply for Rural Areas and Small Communities. And this is really where WHO's work started on small systems and associated guidelines. The last update of the guidelines was already back in 1997, so it's high time to look at a fresh, updated version, considering all the scientific and evidence from practice in managing small systems. But also they come very, very timely, because in our joint efforts in reaching the vulnerable and in reducing inequalities between urban and rural areas and between the vulnerable people and the general population. With that, I hope that you will like today's agenda for the 90 minutes that we have available this afternoon. We will have opening remarks by our senior leadership in WHO and UNICEF, to be followed by the core of this webinar with a presentation on the details of the guidelines and the associated tools that come with them. We will then turn to a panel of experts from different corners around the world to share their views and experiences in managing and regulating small systems. And we will then move to an open Q&A session that gives opportunity for you to ask questions and to provide comments. And then we will point to future events in support to these guidelines. Okay, with that, I have the great pleasure to give the floor to Dr. Maria Nera, who is the Director of the Department of Environment, Climate Change and Health at WHO headquarters. And Maria's team was in charge for developing these guidelines. So it's wonderful to have you with us, Maria, and I hand over to you for opening remarks.
Thank you, Oliver, and what a pleasure to be with you today. I was looking at the number of participants and it's only increasing. So seeing this interest around the world on what we are doing here today is very exciting and definitely a great opportunity. And I think it's very useful to remind all of us that if we want to talk about health, about well-being, about development, about the economy in a country, everything starts with access to safe water, access to water. That's why WHO, on behalf of WHO, like Oliver, let me welcome you to this important event and to this opportunity of launching these guidelines for small water supplies and sanitary inspections rule. As Oliver said, there is a history behind. It has been a long time ago when we did the other ones. And what I think is extremely important is to remind all of us that when we say small water supplies, small doesn't mean less important. On the contrary, there are small water supplies for people that normally is the one left behind, for people that lives in isolated areas, for people who normally we will invest less resources in all of that and these small water supplies. But let's put some figures on the table. And on this one, I'm very pleased to be able to do this launch with very strong partners that we are working today, like UNICEF. They are our partners on many things, and we are extremely happy of this collaboration, and the Rural Water Supply Network. The figures I want to put on the table, probably everybody knows it, but I think it's important to remind them. In the time when we are talking about artificial intelligence and immunogenetics, unfortunately, we still need to remind people that 2.2 billion among our population are still lacking access to safely managed drinking water in 2022. This is absolutely an insult to our intelligence, not only the artificial one, but our brains and our intelligence. And it's something that we need to correct. And unfortunately, and obviously, most of them, they live in rural areas. That's why the ones that deserve this attention. I think these guidelines will contribute. Normally, the small supplies, as I say, they receive less resources, less support. And that's why we have an additional moral obligation to make sure that, as I say, the fact that they are small doesn't mean that they will not have a huge impact in the life of the people that unfortunately are less privileged as we are. People that we are used to, in the morning, we open a tap and we have water, but this is not the case for many people around the world. So I think that our member states remind us when everything started. Unfortunately, this is still something that needs to be very high on the political agenda. It's still not finalized. We still have a huge gap to correct and make sure that these people will have options. And that's why, again, adopting these guidelines will represent a big improvement on the health of many people that at the moment are not benefiting from this. Remember the 1.4 million deaths associated to lack of safe water and sanitation. So keep that in mind, those who are suffering, and I'm sure that this will help all of us to scale up, to use these guidelines in the best possible way. I know that you will have several presentations, so I don't want to keep more time. And just thanking everyone, and particularly the participants from all around the world. I'm reading the chat, and it's amazing to see you all here. And I'm sure that you will use those guidelines in the right way, and we can have a positive impact. Thank you very much, and thanks to UNICEF and the Rural Water Supply Network. Over to you, Oliver, and thanks for sharing so well. Back to you.
Thank you so much, Maria, for your very clear words and reminding us of the health case for looking into improving small water supplies. Very important. I'm very pleased now to introduce to you Cecilia Sharp, who is with UNICEF and has a long name. So I tried to get this right, Cecilia. You are the Director for Water, Sanitation and Hygiene and Climate and Environment, Energy and Disaster Risk Reduction. It's a great pleasure to have you with us today, and I'll hand over to you for some opening remarks.
Thank you, Oliver, so much. And disregard my long title. Cecilia Sharp is perfectly fine. So thank you, Maria, for your nice introductory words. And I'm really thrilled to see so many colleagues, known and unknown, that are connecting to this webinar. It's absolutely amazing. And I suppose it's a recognition of this importance of small water supplies and the challenges and opportunities for improving public health through the delivery of safe water. It's urgent for everybody. So really happy to see. I would really like to thank the Rural Water Supply Network for supporting this organization of the webinar. You are very dear to me. We have a long history together. WSN is, as I think Sean even said, maybe an organization that is working in 168 countries, 13,000 members, and more than 30 years of work in rural water supply. So I cannot think about any organization or forum that is better to launch this absolutely critical guide that's coming out. And I think so many of us have been waiting for, honestly. And you alluded to that, Oliver, that you've gone back to look at what we had before. So this is really something critical for our sector. And I think water quality, and particularly in small water systems, is something that we, to some extent, have been overlooking, or we have been assuming that it is being protected by the soil cover or the construction itself. And this is in our urgency to provide people with the much needed services. So we have been focusing maybe more on the services than the quality of the water itself. And we are also still struggling with the hundreds of millions of people that we already heard that are underserved or not served at all, or having water that do not meet the necessary water quality standards. So with the impacts of a changing climate, extreme water events, I think that these are no longer exceptional, but are becoming more frequent and more intense. And when we are now starting to recognize the multitude of the risks and stresses that rural water utilities and service providers face, we realize that water security and water safety are even more important than ever before. So I think this is the reason why the development of these new guidelines by WHO is so important, and hopefully respond to the articulated needs that we have in the sector to provide safe water. So just with this, a huge thanks to WHO colleagues who has developed the new drinking water quality guidelines for small systems and the sanitary inspection guidance, but also a recognition of the contributions to some of my UNICEF colleagues who provide inputs, and the collection of good practice examples from countries around the world where we all can learn from how this works in practice. And they are collected in an annex to the guidance. So just to finish off with saying that this guidance is also a great example again of the collaboration within UNICEF and WHO and with the wider UN family at large. So with this very, very brief introduction, I'd like to pass the floor back to you, Oliver. And thank you for organizing this.
Thank you so much, Cecilia, and also for highlighting that we all need to walk hand in hand across the agencies when it comes actually to implementing the guidelines and making the recommendations in it, kind of bringing them into practice and the good practice in countries and in rural areas. Now, I hope you all have become very curious. We have been speaking about the guidelines, but haven't seen them yet. But this will now start happening now. So I'm very happy to introduce to you a troika of 3 presenters. First, Jennifer de France, who is leading the team on drinking water safety and quality in the WASH team in WHO Geneva, together with Angela Reinhold and Rory McKeown, who have been working together and leading the process of the guideline development. And Jennifer, Rory, and Angela will now have a go and introducing to you the core elements of the guidelines. I'm very curious, Jennifer, and hand over to you.
Thanks so much, Oliver, and thanks to all who are joining this webinar. We're so excited to see the interest in these new tools. Next slide, please. So here's an overview of this presentation. I'm going to start by providing background information on why we updated our guidance for small water supplies. Then I, with my colleague Angela, we will provide an overview of the revised guidelines on small water supplies. And then this will be followed by our colleague Rory, who will provide an overview of the revised sanitary inspection packages. Click, please. So with this brief presentation, we hope that you'll become familiar with the objectives of the guidance and tools, and also this provides context for the discussions we will be having later in this session, reflecting on the applications of the guidance and tools. Next slide, please. So you've heard about the long history with the WHO guidance, authoritative guidance on water safety. We now have the latest edition of the guidelines. It's the fourth edition incorporating the first and second addenda. It's a mouthful that was last published in 2022. Now, since 2004, however, the central recommendation has remained the same. This is the same recommendation in the 2022 guideline, and this is the framework for safe drinking water. We say that this framework is a basic and essential requirement to ensure safe drinking water, and it requires collaboration from water suppliers, regulators, and surveillance agencies. Of course, there's other stakeholders, but the framework really defines these key functions. So water safety plans were first introduced in the guidelines, actually in 2004, when the framework for safe drinking water was introduced. And water safety planning is a proactive, preventive, risk management approach encompassing the whole water supply chain, so considering from catchment all the way to consumer, to be developed and implemented by water suppliers to most effectively manage the water supply system. Now, this should be guided by regulations, where regulations should promote or require water safety planning and include health-based targets. These are usually expressed as water quality targets, so usually a list of parameters and associated limits. Now, the function of surveillance is to make sure that risk management is effective and that regulations, including health-based targets, are being met. Click, please. So while we have this framework, we do recognize that there are challenges to implement this recommendation, particularly in small water supply settings. Next slide, please. So now we want to hear from you. Please click. We want to hear from you. How are small water supplies defined in your country? So now you see the poll coming up. So please click on which responses are most relevant for your country, noting you can choose more than one. We want to know, how are small water supplies defined in your country? Is it by population served? Is it by the volume of water supplied? Is it by the number of service connections and or by the technology type? Is it by geographic location? So for example, in rural areas, or is it by management entity? So for example, maybe it's considered by households and communities. So can we see the responses, please? So what this shows us is that countries define small water supplies differently. There's many ways that can be defined small water supplies. Can you close the poll, please, now? So recognizing this, the WHO guidelines for small water supplies do not attempt to define small water supplies. Rather, it recognizes the common challenges they face. Please click. And we heard about some of those challenges related to limitations in operations and management, all the way to political intention. And so small water supplies are more prone to breakdown and serving unsafe drinking water. And we heard the statistics from Maria about the impacts it has in terms of illness and disease. So while this is a stark situation, we need to be reminded we have the tools to overcome this. And so there's tremendous opportunities to improve the public health and well-being of many, many people in addressing inequalities we see with having access to safely managed drinking water services. So as Oliver mentioned, the position we take in these guidelines is that small water supplies require explicit consideration in policies and regulations, and there's a need for tailored approaches to address small water supplies and provide supporting tools. Now, I've mentioned update a few times, so just to reiterate, as you've heard, we have this guideline from 1997. So these new resources, the guideline on small water supplies, as well as the sanitary inspection packages, update the 1997 publication. Next slide, please. So what key changes have been made? I think we would all agree since 1997, there's been a lot of learnings in the WASH sector. Because of limited time, I'll just highlight one, and that's on preventive risk management. As I alluded to before, the 1997 guidelines did not include the concept of water safety planning. And since its introduction in 2004, there's been a lot of learnings with risk management, and that's reflected in this updated guidance. There's additionally more guidance, updated guidance based on learnings on the other aspects of the framework for safe drinking water, including regulations. The guidance has also been better targeted to decision makers. So that is, those have responsibility at the national and subnational level for developing regulatory frameworks and associated programs for risk management and surveillance. So that's a key target audience, but I think it's important to note that the guidelines are relevant for many other stakeholders as well. So the guidelines now cover a broader range of supplies. So the 1997 guideline was for surveillance and control of community managed supplies. And this guideline is covering supplies that are managed by the household, community, as well as managed by professional entities, covering point sources all the way to pipe systems. And so the aim here was really to provide more tailored guidance that covers these broad typologies of small water supply systems. Next slide, please. So from this slide, I just want to highlight that the update of this guideline was a really robust process. So actually, even before 2013, there was a systematic review of the 1997 guideline with a proposal on what key updates were needed. The guidelines were updated based on the review of the evidence, as well as from experiences from practice, based on a number of mechanisms through peer review, surveys, looking at the evidence from the literature, etc. And so I really want to just take the opportunity again to thank everyone who's been involved in the guideline development process. This includes a working group that was established that oversaw the development and finalization of this publication. I'm really pleased to see that I saw some members of the working group, as well as other key experts involved in guideline development joining this webinar. Next slide, please. So the recommendations and the guidance in the guidelines, there's 10 cross-cutting principles that underpin all of that good information. And I just want to highlight a few of these. And this includes adapting for context. The guidelines should be adapted to the country situation. This includes addressing risks that are relevant for the country. Now, recognizing that small water supplies often have limited resources, it's imperative that a risk-based approach is taken to first start with the highest priority risks to maximize public health benefits and to progressively over time address additional risks as capacities and resources are gained. So really the aim of the guideline is to provide this practical advice to support this progressive improvement. And I should highlight with this the aim to be practical, the guidelines have been significantly revamped to try to make the guidance much more accessible in terms of the wealth of information the guidelines covers. So these other cross-cutting principles are really important, but we will get to some of these in some later slides and hopefully during the discussion. So next slide, please. So this shows the structure of the guidelines. You can see that the framework for safe drinking water is prominent through chapters 3 through 5 of the guidelines. Now, you see this chapter 2 on assessing the enabling environment. And this is recognizing that water quality needs to be considered in the wider context of ensuring safe, sustainable water supply services. So water quality needs to be considered in the wider consideration of broader governance, finance, human resources, and other elements of the WASH system's building blocks. It can't be considered just in silo. Now, ensuring effective use of data for action is a critical part of surveillance. But we know based on data from UN Water GLASS. So GLASS is a global assessment and analysis of sanitation and drinking water program. We know from their reports that more attention for the wash sector as a whole needs to be had on making sure that there is this effective use of data. And so accordingly, we've devoted a whole chapter that's addressing more broadly improving data use. Next slide, please. So with that, I hand it over to Angela.
Thank you, Jennifer. And thanks to everyone who's joined us today. I see that we have now passed 850 participants, and we are just so excited to see this level of interest in the guidelines and to be able to share these resources with you. So for this part of the presentation, we're going to take you on a little bit of a tour of the inside of the guidelines to show you how the guidance is presented in a way that we hope you will find very practical and user-friendly. Next slide, please. So here is a look at the major elements of the guidelines. First and foremost, at the heart of the guidelines, we have 6 recommendations to improve small drinking water supplies. And for each of those 6 recommendations, there are a handful, somewhere between 5 and 9, practical actions that support the implementation of those recommendations in the context of small water supplies and the challenges that they tend to face. And then lastly, as Cecilia mentioned in her opening remarks, we have a collection of nearly 60 good practice examples from countries around the world that demonstrate how the guidance is being applied in practice in a wide variety of contexts. Next slide, please. So these are the 6 core recommendations in the guidelines, and we wanted to walk you through each of these because they are so central to the publication. So the first recommendation in the guidelines is to assess the enabling environment for small water supplies, to understand where are the gaps and where are the strengthening opportunities. The second recommendation is to establish regulations that reflect priority risks in the local context. And the third recommendation is to work toward professionalized management of small drinking water supplies. And by this, we're talking about water supplies that are operated and maintained by well-trained and qualified individuals that are working within clear accountability frameworks, for example. The fourth recommendation in the guidelines is to promote and support water safety planning by small water suppliers. The fifth recommendation is to practice risk-based surveillance. And the sixth and final recommendation is to strengthen systems of data use to be sure that information that's available on small water supplies is being put to good use to inform decision-making and improvement action. Now, for the next couple of slides, what we'll do is we'll focus on just one of these 6 recommendations. Sean, if you could click, please. We'll focus on the recommendation that has to do with water safety planning, with the idea to show you the sort of guidance that's provided for each of the recommendations. Next slide, please. So I mentioned that for each of the recommendations and the guidelines, there's a set of practical actions to support implementation of that recommendation. And these are the 7 implementation actions for the recommendation on water safety planning. The first action is to understand different risk management approaches, in particular, water safety planning and sanitary inspection, and how these relate to each other. The second and the third actions are to establish risk management requirements in regulations and to consider a staged approach to rolling out these requirements in the context of small supplies, considering resources and capacities. The fourth and fifth actions are to provide the training and the guidance and the practical tools that small water suppliers need to enable them to implement water safety plans. The sixth action is to ensure that there's sustainable financing. And the seventh action is to link to other WASH initiatives to make sure that water safety planning is part of holistic WASH programming. So for the next slide, what I'll do is talk about just one of these 7 actions, again, to show you the sort of guidance that's provided for each of the implementation actions in the guidelines. So this action relates to establishing risk management requirements in regulations that are appropriate and that are achievable. If you could click, please, Sean. So in the guidelines, you'll find guidance on when to use different risk management approaches and tools, in particular where water safety planning is strongly encouraged, and then where sanitary inspection that includes includes management action. So here we're not just talking about identifying risks through inspection, but also taking action to address those risks. So where sanitary inspections can provide an appropriate interim risk management approach where water safety planning capacity is still being developed. And also where sanitary inspection may be an appropriate alternative risk management approach, where water safety planning is just not considered feasible. For example, in the context of household managed water supplies. John, if you could click, please. And in addition to guidance along these lines, the guidelines include a practical example from Germany in this case, where risk management requirements vary according to water supply size. So in this case example, we learned that in Germany, water supplies that serve more than 500 people are required to implement water safety plans. And this is in line with the revised European Union Drinking Water Directive. Now, in Germany, smaller water supplies are also required to implement water safety plans, those serving more than 50 people. But those supplies are allowed more time to comply with the requirement as compared to the larger supplies. And for smaller water supplies, operators are required to carry out inspections of the water supply system on an annual basis to make sure that any issues that could affect drinking water quality are identified and managed. And in the case of individual household supplies, sanitary inspections are encouraged and practical tools are provided to help householders undertake those sanitary inspections. So this case example teaches us that in Germany, all water supplies are required or encouraged to undertake some form of risk management, and the particular requirements vary according to water supply size. Next slide, please. That concludes our very brief tour of the inside of the guidelines, but I hope that that's given you a sense of the sort of information that's provided and how it's structured, and we hope it's piqued your interest to further explore the document. Now we have another complementary publication. It's an executive summary. So the 6 core recommendations that I mentioned and the implementation actions are all summarized in this roughly 10-page document that's available in English and also in Arabic, French, Russian, and Spanish. And I think somebody may be inserting a link to the executive summary in the chat box now. If not, we'll be sure to do that later. So this will be an interesting resource for you. And with that, I will now hand over to my colleague, Rory McEwen, who will introduce the new and much anticipated sanitary inspection packages, which are a fantastic resource and an important complement to the guidelines. So thanks for your attention, and over to you, Rory.
Okay, thank you very much indeed, Angela. So before we move on to the next segment, we are just going to run this poll that should be popping up on your screens, just to give you all a bit of a mental breather, and also for us to better understand your level of experience with sanitary inspections. So we'd ask you all to consider which of the following 3 categories best describes your experience with sanitary inspections. So you'll tick A if you've no past experience, maybe never heard of them for this webinar. B if you've some limited experience, you've maybe encountered them on occasion in your role. Or C, if you've been maybe actively involved in sanitary inspection related work, you might have included them in your drinking water quality programming or conducting them in the field, depending on your role. So I think we'll close the poll there and just wait for the results to pop up on screen. And yeah, nice to see we have a fairly even spread in the room. And to some extent, I guess we're preaching to the converted. For the majority of the case, I see there's some of you with less experience in the virtual room, so don't panic. Our next slide will provide some of the basic background on this. So next slide, please. So for those less familiar with the concept, sanitary inspections, in essence, a field-based evaluation, and to help you determine if priority risk factors are present that could contaminate the water supply. The sanitary inspections will typically use a basic checklist like the one shown here on the screen. It's often referred to as a sanitary inspection form, and this can be supported by an illustration that shows priority risk factors, which may be, for example, issues relating to the physical structure of the water supply and its components, or operational and maintenance aspects that we can see in the image here shown on the screen. Now, although we consider them to be simple, sanitary inspections are a powerful risk assessment tool. And as outlined in the new guidelines, as Angela has touched upon, They can be used for drinking water quality surveillance in terms of supporting progressive improvement and programming, but also for water safety planning. Now, they can support aspects of risk assessment and monitoring, and in some contexts, they can act as that simplified alternative to water safety plans where capacity and resources could be limited. Next slide, please. Now, sanitary inspections are by no means a new concept. They've been applied in the field now for decades. In the top left, we have an example of a sanitary inspection form from our 1997 guidelines, and we can see below this how it's evolved to what we're presenting today. Now, the new sanitary inspection approach has built on this wealth of practitioner experience. And in terms of some of the key changes since the 1997 forms, well, first and foremost, each sanitary inspection form is now supported by new technical guidance and management advice. And these three elements are grouped together in what we're now referring to as a sanitary inspection package. Now, each of these packages is better aligned with the water safety planning approach. They promote corrective action where risk factors are identified, and emphasizing that sanitary inspections are really a tool that needs to be applied routinely to better support ongoing safe management and monitoring, very much in line with the water safety plan principles. Now, in addition, efforts have been made to better reflect climate threats. So, for example, considering flooding and drought aspects, as well as water scarcity, and also equity considerations for all users of the water supply. And lastly, we've recognized that adapting the packages to the local context can be important in some settings. So consideration for adaptation is provided in the main guidelines, and we're also providing the sanitary inspection packages in an editable format for ease of adaptation. Next slide, please. So what is in each package? Well, we have an example here to show you for the rainwater collection and storage, but all 13 SI packages follow this same template. So we firstly have the sanitary inspection form, and this includes a section up front to capture key water supply information and water quality data that can provide context to support risk assessment, as well as supporting the development or maintenance of water supply inventories, say at a national or subnational level. So we have the illustration showing the risk factors and the checklist of yes/no questions. Now, this includes supporting explanatory notes now, and this can be used along with the illustration to help identify common risk factors and, importantly, prompt corrective action. Next slide. Secondly, we have the technical fact sheet. So this provides basic information to support completing the sanitary inspection form. It includes illustrations that show the sanitary conditions, so in the absence of risk factors, and this illustration can be compared to the sanitary inspection form to help sort of identify where risk factors may be present. And the technical fact sheet also includes descriptions of the individual components of the water supply. And next slide, please. Lastly, then, we have the management advice sheet. This provides guidance on basic operations, maintenance, and monitoring that is critical to keep the water supply safe on an ongoing basis. And it also provides troubleshooting guidance on basic corrective actions to consider when risk factors are identified during the sanitary inspection. And last slide, please. In total, we have 13 sanitary inspection packages now, which cover a broad range of typical small water supply technologies or scenarios, and includes key stages of a typical water supply chain in small systems. So in terms of the water source, we have packages 1 to 7, covering point sources such as dug wells or springs, as well as surface water intakes. In terms of distribution and storage, we have packages 8 to 12 that cover elements of a small pipe distribution system, as well as water carding and kiosks. And lastly, the all-important user level, where we have a new dedicated package for household practices. Now, the red stars here indicate packages that are either new or represent a significant update from the original 1997 sanitary inspection forms. So I hope this has given you a reasonable, albeit brief, overview of our new sanitary inspection publication. And we hope this will serve you as a practical tool to support risk management in small water supplies and aid the implementation of select recommendations in our new small systems guideline. So thank you kindly, and I'll pass back to Oliver.
Thank you so much, Jennifer, Angela, and Rory, for that very succinct overview of the breadth of the guidelines, what they cover, with what tools they come together, and what implementers can gain from these guidelines. And I hope that the presentation gave you, dear participants of the webinar, sufficient appetite to look into the copy and to read in further details of what the guidelines recommend. Excellent. Thank you so much. Please join me for a virtual clap of hands that we cannot see here on screen, but I hope you join me in that. Thank you so much. Before we move on to a panel, to invite experts from around the globe for further reflections on the interface between the guidelines and practice of implementation, I just would like to remind everyone that the links have been posted, the links with access to the guidelines have been posted in the chat. And yes, the recording and the slides of this webinar will be made available after the session to all participants, just to reiterate that you will not miss the material here. So with that, I'm very, very happy to turn to the panel that we have lined up for today's session. And we have a wonderful group of colleagues here on the virtual panel that I would like to introduce to you. First of all, I'm going from left to right on the slide. We have David, who is the Principal Water Quality Advisor in South Australia Health Department. Welcome, David. Then we have here on the panel Yvonne Magawa, who is the Executive Secretary of the Eastern and Southern Africa Water and Sanitation Regulators Association. Good to have you with us, Yvonne. Welcome. Then we have with us today Tutut Indra Vai-Huni, who is the Deputy Director of WASH at the Ministry of Health in Indonesia. Lovely to meet you, Tutut, and welcome to the panel. And last but not least, we have James McKinnon, who is the Director of Engagement and Government Relations of the Atlantic First Nations Water Authority and Canada. Very pleased to meet you, James, and welcome to the panel. So I would like now to ask the Secretariat to spotlight our panelists so that participants can see you better. And I would like to start by kicking off this panel by addressing Yvonne. So Yvonne, you have vast experience also in your previous career as a regulator in Zambia, and of course also within your role within the Eastern and Southern Africa Water and Sanitation Regulators Association. And I would like to ask you in terms of what do you see as the key gaps that need to be addressed to improve small water supply service delivery in Africa and possibly beyond? So what do you see as the key gaps that are on your radar? Over to you.
Thank you very much, Oliver. And just to also say well done to the WHO team for these guidelines, which are very, very relevant for us, especially in the African continent, looking at small water supplies. In terms of the key gaps that we see, for us as regulators, we look first at the enabling environment. For us, that is a major thing in order to organize the sector. So we are talking about policy, institutions, regulation, and financing as well. So PIRF in short. So we need strong policy and legislation. Of course, we need institutions with clear mandates. Accountability must be there through regulation and adequate resourcing to execute mandates. So as regulators, as I've said, it is really key for us to have accountability to provide services. And this is through a professionalized approach, exactly as recommended in the guidelines. And we see examples in Uganda and Zambia with utilities absorbing this mandate. So organizing the sector to have a professionalized approach. People tend to assume that regulation is about tariffs, but really the top priority is safeguarding the health and well-being of people. So this is by setting and enforcing standards and requirements for the quality of service, ensuring that the water quality is good, the quality of service in terms of the delivery mechanisms that are there to be able to ensure that consumers at the end of the day are guaranteed a certain quality regardless of the size of the service delivery method. Thank you.
Thank you so much, Yvonne, particularly for highlighting the need of having regulations in place and that accountability is one of the keys actually to ensure small rural supply services consistently. And David, departing from Yvonne's point on the regulations and the need for strong governance instruments that cover also small water supplies. So based on your experience in Australia, including in the context of rural water supply regulations, so what advice would you offer related, on the one hand, having regulatory instruments in place, but balancing them also with support mechanisms? Because regulations alone may not make the trick, right, David?
Yes, you're right, Oliver. For us, support is by far the most important component of our regulation, of introducing our regulations. So the aim of the regulations, which have been in place for about 10 years, was to establish a drinking water community of practice and awareness. So yes, I mean, my department provides the regulation, but more importantly, we provide a source of health guidance and education. We provide a range of tools to assist operators of small drinking water supplies to implement water safety plans. But more importantly, we provide the advice to enable those plans to be designed and implemented appropriately. So we spend a lot of our time talking to drinking water providers, guiding them through how to develop water safety plans. And it's quite an iterative process. So for us, education and support is by far the most important role that we undertake. Part of our regulations include conducting audits and inspections. But again, we don't see those as a mechanism for imposing penalties or taking strong action, more about education. And in some cases, it's about assisting people in undertaking water quality analyses. So for our remote areas, we have portable testing kits that we use. I think it's important to recognize that everybody who's involved in supply of drinking water wants to do it safely and sustainably. And our role is to support that, and the role of our regulations is to support that. We do have penalties as a last resort, but I can say so far we haven't issued any financial penalties in the 10 years of operation. Our strongest action, with the cooperation of a limited number of drinking water providers, has been to declare supplies as being of non-drinking water quality, while improvements are introduced or remedial action is taken. So yes, a very strong focus on support. We do have penalties if we need them, but they're the last resort.
Super, David. Thank you so much for highlighting this message. We need regulations, but probably in the context of small supplies, we need less policing and less penalties, but we need support, advice, and education, and working one-to-one with the suppliers in order to achieve gains in safety and sustainability. Thank you for that very clear message. I'm now turning to you, James. So you are with the Atlantic First Nations Authority in Canada, and we have a very interesting case study in the guidelines from your work context. And so you are sitting on the other side of the table. You are not the regulator, but you are the service provider. So would you be able to share with us your perspective on the benefits that you see of actually being regulated as a service provider of small systems? So do you see any benefits of that, or is that just annoying? Over to you.
Thank you for your question, Oliver. And no, it's not annoying. It's very important. And to start to answer my question, I'd like to begin by setting the current context within Canada. The regulation of water quality is a responsibility that has been delegated through the Canadian Constitution to the provinces. The land where First Nations resides is federal land. Therefore, provincial regulatory regimes do not apply. So aside from some federal minimum performance standards for centralized water systems, there's been a regulatory void in Canada for First Nations. So the Atlantic First Nations Water Authority is a utility that manages, upgrades, and maintains water and wastewater systems on behalf of our owner communities. The Water Authority recognizes this regulatory void and has developed its own regulatory compendium based off the province of Nova Scotia's regulations to ensure there's a clear standard to meet. Now that context is set, being regulated, of course, is paramount to building public trust and being transparent in our standards. Our regulatory framework is composed of both compliance and risk management elements, including water safety plans. The individual elements provide clear guidelines and standards for us to follow. And of course, while standards are good, associated benchmarks and a framework for evaluation is critical so that the Water Authority can continue to improve as a utility and help us meet the liabilities we have associated with the delivery of safe drinking water and clean wastewater. Regulations have a strategic importance for First Nations in Canada as well. Funding for water and wastewater systems for First Nations communities comes from the Government of Canada. And with a regulatory standard to adhere to, First Nations can be precise in their funding requests to the Government of Canada for water and wastewater infrastructure. There is an opportunity now for a new First Nations Clean Water Act that has been introduced in the House of Commons in December of 2023 for First Nations to develop regulations or co-develop regulations that make sense for them. As well, there's an opportunity to work with Canada on a funding framework that addresses the years of chronic underfunding and will help facilitate community growth and economic development.
Superb, James. Thank you very much. Also, particularly for highlighting the close relationship between having solid regulations in place, also as the basis for mobilizing sufficient funding and actually to keep everything up and running as it should be. I think that interface is a very important consideration. I'm now turning to Tut. So I understand, Tut, that the Ministry of Health in Indonesia has recently passed a new decree on drinking water in Indonesia, which also includes a requirement on proactive risk management by water suppliers, pretty much close to what WHO recommends by its guidelines. And I would like to ask you briefly describe a little bit of what exactly the risk management requirements look like for small water supplies in Indonesia, and to share also a couple of key drivers for this new requirement. Over to you, Tut.
Okay. Thanks for the question, Oliver. So thanks for giving me opportunity to share Indonesia experience. Indonesia has more than 390 district water utilities and more than 4,000 small water operators. In 2020, Ministry of Health conducted the first national drinking water survey, revealing and pressing need for increased attention and support for small water supply system. The purpose of the survey was to identify the contaminant in the point of the use and point of access. Numerous water point answers in this system were found the non-compliant with Ministry of Health standards. In response, the government has committed to enhancing the complemented of water safety plans, which were initially focused on complex distribution system to also cover small system. The Ministry of Public Work and Housing has developed the WSP guideline for communal and non-PPP distribution system, providing gradual training for water operator. To ensure effective implementation, the Ministry of Health incorporated the mandate of WSP implementation and drinking water surveillance, including WSP audit for all water provider in the newly decree of 2023. Another important driving factor of WSP regulation in our decree in the significant challenge of only 11.8% of the household having access to safely managed water. The responsibility of attaining safely managed water is not a sole responsibility of the Ministry of Health, but also from the Ministry of National Planning Development, Ministry of Public Work, Housing, Ministry of Home Affairs, and Ministry of Village. Thank you.
Thank you so much, Tut. Impressive to see what you have achieved in Indonesia. Congratulations to that. And I particularly like also that element of gradual training, which also speaks to what David has been saying on providing advice and support in education, but also for highlighting that if we want to make advances with water safety planning, that's really a cross-sectoral effort. And it's not only kind of the Ministry of Health, but also for many other stakeholders. Now, I would like to return to Yvonne you have spoken before, I should say, about the regulatory gaps that you are seeing. And I would like to follow up in this a little bit on if you could speak about a little bit on your organization's role in strengthening regulatory frameworks, but also practices, and how the new guidelines, freshly from the print shop, will serve you as a supporting resource in your efforts. So I'm very curious to hear more about that. Over to you.
Thank you again, Oliver. As I said, these guidelines for us are very timely. In October, we had a regulators conference where we had about 44 countries or 44 institutions with regulatory responsibility in Africa represented. And one of the things that was top of the agenda was the development of regulatory frameworks for rural water supply and sanitation, as well as for small water supplies. So we cannot be in a better position now than to take these guidelines as developed and contextualize them now to our setting. So what we are doing as SOS is we need to do an assessment of the enabling environment as per the first recommendation of the guideline, the aspect of now developing the regulations, putting up a regulatory framework that can be adapted to context by the various countries for small water supplies. And also the recommendation on data is very important for us because we are also trying to strengthen data across the continent, not just for regulation, but for evidence-based decision-making. So we are really working on unbundling what has been provided in the guidelines, but also drawing them down to the context and being able to put up frameworks that can be adapted by the various countries.
Yeah, extremely important, Yvonne. I think this is the key word, bringing the recommendations to national and local context and to adapt of what is being recommended in the guidelines to these contexts. I think this is a very important message here. And now I turn to you again, James. So the guidelines, speaking about the recommendations of the guidelines also stress very much the importance of engaging small water suppliers in the regulatory processes themselves, and in order for regulators to benefit also from the experience and knowledge that the operators have themselves. So which advice would you give to Yvonne actually, and to others, of course, in this call, and how you can effectively engage small system operators?
Sure. Thank you for the question, Oliver. And to answer it directly, that engagement never stops. It's something you always do. You need to build a relationship with those that you serve. And I think the result of that engagement should be that the culture of those who you serve should be reflected in the governance of those regulations. So as I mentioned before, currently there's no legislation establishing standards of care for drinking water for First Nations in Canada, and only minimal standards addressing wastewater effluent regulations. So the Atlantic First Nations Water Authority exists in a largely unregulated and unenforced environment. So during early engagement sessions with communities, following guidance was given to us. So I have two quotes that I'll read. One, water must be looked at in a holistic way. It is connected to the ecosystems of the forest, air, and soil, as well as the people and communities. And another is nature has rights and humans have responsibilities. Stewarding the health of Mother Nature is our responsibility. So those are two quotes that we took during our engagement. So First Nations knowledge keepers, elders, and chiefs work to ensure that the form and functions of First Nations water utility and accompanying regulatory framework would not just be a copy of Western ideals, but would recognize, respect, and implement the worldview of the communities we serve. So to ensure that the Water Authority reflects First Nations values and teachings, the organization held engagement sessions to identify these core values and teachings and develop actions, functions, and structures to embed these values in our organization. These engagement sessions resulted in the identification of these key values, decision-making practices, organizational elements that are woven into our business case, mission statement, and operation of our utility. The foremost of these practices was what is called two-eyed seeing by First Nations elders. The two-eyed seeing principle, in short, ensures that on one hand, we deliver services in ways that honor and celebrate First Nations worldviews and ways of knowing, but on the other hand, also include Western technical practices. It is through these principles that we govern ourselves to adhere to our regulatory framework. Thank you.
Thank you so much, James, for sharing these insights. I think what I take away, engagement never stops, must never stop, I should say, and understanding core values and understanding decision-making practices of the First Nations are key actually also to make regulations in turn effective. If they are not understood, regulations go nowhere. So I think that's kind of, these things will need to go hand in hand. Okay, for the final two questions on the panel, I would really like to focus a little bit on the importance of practical context-specific tools to support the implementation of the regulations, and particularly by focusing on water safety planning and surveillance practices. And I understand to toot that in Indonesia, sanitary inspection is a key surveillance activity, and that the WHO sanitary inspection tools available have been used to develop nationally adapted templates and tools. So could you briefly speak a little bit about the value of the sanitary inspections, the surveillance tool in the Indonesian context? That would be lovely. Over to you.
Okay, there are two categories of surveillance system in Indonesia, internal and external. Internal surveillance involves water supplies conducting surveillance and reporting to the district government, while external surveillance is done by sanitary in primary health center. Indonesia is probably among the first countries that have initiated the updated version of sanitary inspection to see 2018. Indonesia has used sanitary inspection for types of water points. The need for more comprehensive sanitation inspection packages is based on the national survey which identified contamination issues beyond the initially focused area. The new package of water supplies and after additional information for risk management in the phase 2 climate event and pictorial sheets with technical information make sanitation have easy understanding on the risk and remedial action recommendation. These tools, customized for the local context, contribute significantly to the regulatory framework. As of 2023 or 16, sanitary inspection form endorsed by the WHO integrated into both internal and external surveillance systems. There are also considerations of developing digital tools to change to the paperless and electronic reporting system. The sanitation form the complemented by an inspection methodology that guides sanitation using hamlets and water facility for inspection during limiting in human and local financial resources. Given Indonesia's size with nearly 280 million people, the priority strategy enable sanitary to focus surveillance activity on area with the highest contamination risk and potential public health outcomes. Thank you.
Thank you, Tutut, for this very clear message on the added value of using sanitary inspections consistently, and particularly also as a tool helping actually identifying areas where greatest attention will need to be paid when you have pockets or clusters of risks that will need to be addressed as a result of the inspections. Very clear message. Thank you so much for that. And David, now turning to you for having the final word in this panel. It's a big responsibility, I guess. So we heard earlier from Tutut that in Indonesia, they have a regulatory requirement of implementing WSPs, as South Australia has for many years already. And I'm curious to learn more about what tools you have been developed in South Australia to support small water supplies and implementing risk management requirements in the field. Over to you, David.
Thanks, Oliver. We have developed a range of tools, and the aim of the tools is to demystify water safety plans, or the concept of water safety plans for operators of small systems. Yes, it's their business, but it's not their core knowledge or often their core activity. So we have to provide as much assistance as we can. We've developed a range of templates for water safety plans for the simpler systems. So for small rainwater tank-based systems, which are very common in South Australia, we've developed a subset for water safety plans for rainwater tank-based supplies in higher risk premises. So we have hospitals that provide rainwater for some of their patients. We have aged care facilities that do that as well. We have food manufacturing premises that use rainwater in rural and remote areas as their source of water. So we have generic plans for those. We have generic plans for small bore water supplies, and we even have a partial plan for reverse osmosis plants, because a lot of our groundwater in remote areas is quite saline. So reverse osmosis is a requirement. And what we're trying to do with these plans is to convert the information in the sanitary inspection packages that Rory talked about into a cohesive plan. We try to keep it relatively straightforward, simple but effective, and recognizing that these plans are going to be much smaller than the large water safety plans that our big water providers have. So very keen to have the essential information in those plans. We've got a range of other tools, a lot of communication tools. So on our website, we have lists of auditors and inspectors. We have lists of laboratories that providers can use, and we have appropriate forms. So a key component of our water safety plans and our regulation is our incident protocol. So for us, it's really important that if something goes wrong, the drinking water provider calls us and completes a form, sends it in to us to communicate if something is going wrong. So we provide the tools for that. And we support that with constantly being available. So we have a 24-hour a day, 7-day a week service. If somebody wants to call us, they're there. So we have this package of tools to try and make it as straightforward as possible. Because we talk about water safety plans, but somebody operating a small drinking water supply 1,000 kilometres away from the capital city in Adelaide, this is a bit of a foreign concept for them, particularly at the start.
Thank you so much, David. Impressive to see what you do in South Australia in breaking down concepts into some practical messages, demystifying, unpacking, and making it tailored to the working reality of the operators of small systems that may be very remote and have limited access to day-to-day advice, so to say. So thank you for putting a spotlight on that. And with that, I would like to conclude the panel by thanking you all for sharing your valuable experiences and in also reflecting vis-a-vis the guidelines being launched here and today. And I think the panel discussion has clearly shown how the guidelines will add value to all your work context as an authoritative source in resource to further strengthen your work and what you do in support to small systems. Thank you for that. Now we turn to an open Q&A session, and I would like to ask the panelists to stay where they are, because we may turn some of the questions that flowed in also to you and would invite you to help with answering them. But I would like to express the sincere thanks to all participants of this meeting for the vivid communication in the chat, but also in the Q&A section of this webinar. And whereas for now in the Q&A section, we can only cherry pick a few questions due to the sheer volume of what is coming in. So we'll need to make a few difficult choices here. But on the other hand, please be reassured that all participants will receive, after the webinar is closed, perhaps a few days or a week later, unanswered. We will produce an FAQ, so by which we will answer questions that remain unanswered during this session, and we will make sure that we provide your responses to whatever couldn't be discussed during this session. And I hope this is satisfying your needs. So I would like to now turn to some of the questions that have come in, and I would like to start with a question that was put forward by Brian Reed. And Brian is asking the following. Or observing and then asking that public and environmental health may be the priority for the health sector, but it's not necessarily the priority for all stakeholders like gender, environment, social stakeholders. And how can these contrasting or even competing interests be balanced, and how can we balance investments in water quality and those more focused on water quantity? And I would like to bring in at this stage also Bruce Gordon, who is the head of the WASH team in WHO headquarters, and ask Bruce to have a crack on Brian's question. Over to you.
Well, thanks so much, Oliver, and thanks, Brian, for the easy question. And I do want to acknowledge that I think all of us, on the call are fighting a little bit from our corner to try to get more attention to, investments in drinking water supply in smaller systems. I mean, I think within the context of health, I think that there's often, kind of going to disease-specific interventions, and we almost have to wait for a too little, too late approach with, for example, cholera or other disease outbreaks. I know some countries on the call probably saw quite a bit of prioritization after an waterborne outbreak. ODA is going down a little bit for water and sanitation, and our analysis of public expenditure and overall expenditure, hasn't risen greatly. So it's a good question. And I would be tempted to sort of say, well, there are tools, certainly with the water safety plan approach. We're talking about risk assessment and trying to find, a reasonably, I guess, inexpensive way to come to the same conclusion of delivering safe water. But sometimes I feel like the real, I guess, issue is political attention. And so one thing that I think you'll find interesting new about the document, I think it's chapter 2, is on the enabling environment. And that is actually quite a departure from what we've had before, where we've just kind of focused on, technologies and management. But here we recognize that if there is not a chapter that deals with, kind of trying to strengthen the architecture of the systems, the governance, all these kind of things that will drive the correct investment and prioritization for something that's a human right, the sort of that it will not succeed. So I think I'll stop there, Oliver, but just to say, I think some of these prioritization questions do come down to politics. And politics comes down to sometimes, I guess, putting your elbow up and saying, you know what, we haven't made a dent that we need to make in terms of safe water, which we heard from the beginning with Cecilia and Maria's remarks. So we have to keep all of us, kind of advocating over.
Absolutely, Bruce. I couldn't agree more. And I bet that the guidelines will also support making that case vis-a-vis the politicians on the terms of what is needed and what systemic issues still need to be addressed in the context of small systems. Thank you so much for that, Bruce. There's a next question which comes from Bilaku. And David Cunliffe, I would like to put you on the spot with that. So the question is, developing and implementing water safety plans can be complex, involving multiple steps and stakeholders. And this can be sometimes overwhelming for small water system operators or communities with limited resources in place. And the question is really, what do you recommend for such settings and conducting water safety plans? I guess it's very straightforward.
No, it isn't. We deal with water safety plans in the language all the time, but operators of systems don't. So I used the word before, and I think you recognized it, that our purpose is to try and demystify water safety plans as best we can, and to try and to simplify the process and to walk people through the sensible measures to ensure provision of safe drinking water. I think in my situation, it's made a little bit easier because for those people who know Australia, we're a very dry continent. In my state, we don't have a lot of surface water supplies. We deal with bore water and rainwater supplies. So our aim is, with our generic plans, is to develop a step-by-step process. It's iterative. It can involve a lot of conversations. So we'll have a drinking water provider talk to us, then they'll attempt to complete a water safety plan. They'll submit it to us. We'll have a look at it. We'll see where they've done a good job, where it needs some improvement, and go through this process of designing the water safety plan to ensure safety. I think trying to stress that a lot of it is reasonably common sense. I mean, if you look at the sanitary inspection packages in these guidelines, they're reasonably straightforward. There are not a small number of steps, but a limited number of steps and processes that you need to implement to provide safety. And I think another important component of the guidelines and this document is the most important thing is get started. Get started with your water safety plan. That's by far the most important thing. Then you're on the path to ensuring safety, and that's what we have to support doing. And by the way, all of this goes back to the fact that yes, we have regulations, but the regulations really are about support and helping people through. And if they've got a more complicated system, we need to spend more time with those folk to help them.
Super, David. I couldn't agree more on that very short sentence, get started. I think getting started is a very important message, not getting overwhelmed by a system, but try to make advances step by step by implementing water safety plans and not getting distracted by complications. But each step is an advancement in the management of the small supplies. Okay, and then I would like to open up a third cluster of questions, which is related to sanitary inspections. And we have quite a few questions coming in to this end. And I would like perhaps ask Rory to help with reflecting on those questions. And so the question is, one of the challenges in relation to sanitary inspection that we regularly face in the absence of standardized approaches is the lack of consistent sanitation inspection methods and protocols across regions, agencies, that lead also in turn to inconsistencies and potentially missed risks. And, and then the question is, what is your plan, Rory, to populate and disseminate these tools on a scale? And connected to this, a second question, and what do you think of what training are there any issues you think training should highlight with a view on sanitary inspections? Over to you, Rory.
Okay, thanks very much, Oliver, and thanks to the participants for the great questions. I'm really glad the question of training has come up. We talked earlier about sanitary inspections being a simple approach, which they are, but that doesn't mean that training isn't important, and it should be considered, when applying sanitary inspections in any context. So you can have different users of the packages as well, which needs to be considered. It could be simplified SIs for households, or, more sophisticated for water suppliers or surveillance staff, but they all should have that sufficient knowledge to ensure, consistency and accuracy of results, to inform, action at the local level, but also to ensure that there is, reliable data being generated either nationally or subnationally to inform policy and programming. And linking with one of the discussion points earlier about the supporting role of authorities. So really that's where it comes to the fore here, I feel. There is a need to consider developing capacity building programs. This can include training packages that are tailored to the local context, and, particular aspects, different people's perception of risk, I think, is one of the key elements for ensuring consistency. And it is something that can be managed, by basic tools, say having, operational definitions for what is a superficial crack versus a deep crack. They can be easily integrated into national training programs as well. And on the first part of that question about supporting dissemination and uptake, we'll of course be working closely with our partners that are here today to make sure these are shared far and wide. And we'll also be considering some technical webinars, I think, which will be touched upon later. Thank you.
Thank you so much, Rory, for these reflections on the sanitary inspections, also highlighting that there is more to come after today in terms of support further dissemination, but also building capacities on country level. So maybe I don't know, I can't see the audience here, so I'm speaking a little bit in the dark hole, but if everyone agrees, we would probably suggest to spill over for 5 to 7 minutes to accommodate another couple of questions before we are moving to the close, if everyone agrees. And as I cannot see the answers, I assume majority agrees here. And I would like to bring forward a question that actually comes from a former colleague of ours, from Robert Boss. And Robert basically observes that some 10 years ago, the narrative around small community water supplies was about the lack of technical knowledge, experience, and capacity to operate and maintain the systems. And today's discussions seem to show a shift to the need for regulatory frameworks and surveillance. How does this link to the previous focus, and is this addressed in the guidelines these days? And I think I may add, and basically on how that link to the overall observation that were also made earlier by James and Yvonne on the need for professionalizing operations and management of small water supplies. And I don't know, James, Yvonne, would you be ready to offer a reflection on this observation of Robert here? James, I see you on screen. That means yes, perhaps. So can I put you on the spot with that?
Yeah, sure. I think, if there's a link between it, I think it can't be unlinked, as you could say. So of course, you need regulatory standards to meet and aspire to. But from the water authorities, the Atlantic First Nations Water Authority perspective, the professionalization of our staff has been important. So a little bit of context from our organization is we operate in 3 provinces in Atlantic Canada, and we're centrally managed. Our CEO and procurement happens at a central office, but our communities are across all of Atlantic Canada. So we were able to create economies of scale, especially in our operations department, to have, superintendent of operations, superintendent of technical services that looks after our SCADA and instrumentation, and provide that level of professionalization to our on-the-ground staff. As well, being a larger organization and amalgamating the services between the 12 communities we serve, we're able to have dedicated staff to the training and professionalization of the staff on the ground. So with that support, we can continue to aspire and meet to the regulatory standards that we put in front of us.
Thank you. Yvonne, do you want to come in here and build on James' observations?
Yes, just to say very quickly that one of the issues that's actually motivating regulators to do something about small water supplies is the same issues of maintenance, operation and maintenance of the infrastructure. The rate of breakdown is just too high. And how do you then resuscitate the infrastructure at the end of the day when the communities don't have the capacity? So like the examples which I gave earlier for Uganda and Zambia, where this is being brought under the umbrella of utilities, to be able to manage these small water supplies is also, to what James is saying, economies of scale. So you take advantage of a larger entity that can subsidize to a certain extent within its operations and bring the community-based managed supplies, maybe in some cases community-based, but bring them under a professional umbrella that allows operation and maintenance to continue, but in a professionalized manner and with sustainability. So that is the consideration that is there with regulation.
Okay, superb. Thank you, Yvonne and James, for re-emphasizing the issue and the need for professionalization in order both to meet regulations, but also to build the technical capacity of staff or community members running these supplies. I think these are key ingredients towards making success and making these systems safe on the long run and in a sustainable fashion. So with that, we have reached the hour, but the seminar is not yet closed. And I now have the great pleasure to invite Bruce Gordon. As I said earlier, Bruce is managing the WASH team at WHO headquarters, whose leadership the guidelines have been developed. So really congratulations, Bruce, and your team for making this important step. And Bruce will now speak a little bit towards the end of this webinar of what is coming next, what you can expect of WHO as follow-up to this very launch webinar. And with that, I say already bye-bye and thank you for your attention and hand over to Bruce.
Thanks so much, Oliver. So just, 2 slides left, and so it'll be quick, but this is the really exciting part for us because we're certainly going to be advising all governments and ministries to align with these recommendations to the extent possible. They're advisory, but they are good practice. And then there's a whole program of work which many of you spoke about and had questions about how we're going to move into the future. The first issue, of course, is translation. You saw with the executive summary, we have translated executive summaries, and then it's a bit of a work program to make sure these guidelines are translated into numerous languages. We expect the French version as a first step in the second quarter of this year. As far as training packages, we're really excited to bring to you different presentations, whether they're focused on one piece of the guidelines along the lines of some of the specific questions or whether they're on the overall guidelines themselves. We'll be working to make those available so that you can also use those yourselves. We have an exciting bit of work on field test kits in the sense of evaluation results, in the sense of how to essentially pick them, use and apply them in regulation, and make sure that they're being used to their best advantage. As far as technical webinars, our first is going to be on the sanitary inspection packages, which we imagine will start in the second quarter as well of this year. And we have a number of candidate webinars that we would like your feedback on. So if you could go to the next slide, I'd just like to take a quick pulse or understanding of what you would like to see. So we'll go through this quickly and see if there's any big decision making, because some of you are decision makers, actually all of you are decision makers now. So if you can just please, whether you feel like you would like to see something that's more on risk-based regulations, in other words, the water safety plan approach, the implementation of the water safety plan approach in the context of small supplies, of course, the issue around sanitary inspection and the inspection packages, the second last one on surveillance, or we had some questions around capacity, which is, the skills and expertise that's required to run these supplies and their supporting frameworks around them. So I'm not going to give you too long to vote, but I'm wondering if we can just close that and just see if there's a mix or what we're seeing a little bit of a mix. I'm not seeing there's a top, strengthening water. So people want to learn, they want to build capacity. So I think that's our winner today by a short margin. So we'll work on that after the sanitary inspection packages. And thank you for that. And My final slide is just to really thank everyone, the whole community. These guidelines, as was mentioned earlier, they build, on the shoulders of all of yourselves. And I realized there was nearly 1,000 people at one point on the call, and some of you asked amazing questions, innocent questions, but you are the experts and you've helped us make these guidelines possible over years. Some of you are students, some of you are engineers, some of you are decision makers and directors in ministries, NGOs, international organizations. What was remarkable to me was that there was full global representation, and we're committed to take these guidelines to the world. So thank you so much for being involved. And we're going to discuss later about establishing a community of practice, potentially through our RWSN, but we'll try to stay connected on these. As far as the event, we've heard a lot of thanks already for RWSN and our partner UNICEF on this, but as I said, we're very grateful, and of course, I would need to thank Oliver for moderating this, all the speakers and moderators, and all of you who've asked these really great questions, of which we can only answer a few. Now, my last thanks is on the contributions and the specifics of some of the folks that contributed. So this is very personal at some point, because there's a small group of people that have put a ton of work in. So Jennifer, Angela, Rory, thank you so much. And I'm not going to go beyond that, because there's other people that have put a ton of work in as well. But as I said before, we are working with, a lot of colleagues over years. We have an expert committee. And I think now I would just want to say that all of us collectively want to work to benefit those that need these supplies the most. So these are Indigenous people, women, children, men and boys that live in vulnerable areas around the world. And I think we're all committed to that. And as Brian Reed talked about prioritization, this is hopefully this is a way we can prioritize and use good practice. So thank you all. And I'm sorry if I missed anyone, but we're really, really grateful for your participation. And most importantly, we look forward to being in touch with you as we roll these out and implement them. So thank you. And I'd like to close the webinar.